We do lack essential local supplies. It's quite difficult to be able to put together enough donated supplies to be completely self-sufficient when you come and operate in a country like this. If we could rely on a lot of those supplies being locally sourced and locally held, that would certainly make the logistics much easier.
Could you elaborate on those supplies you need?
Those supplies are as simple as surgical gowns for a start. Diathermy pens, swabs, sponges, lap sponges, essential surgical supplies.
So CWM currently does not have them, or they're lacking in this?
I don't know whether they currently don't have them, but the cath lab team have had difficulties in sourcing those kind of supplies.
Anything else? You have mentioned the important parts of the need for a cath lab and more pacemakers to be brought into the country. And you also mentioned about how many Fiji needs, how many you have brought in so far. And you also mentioned the need for follow-ups. Could you elaborate on that?
Yes, so once the patient has their device implanted, while the battery will last a certain number of years, anywhere between 8 and 12 years, it's really important that every patient has at least an annual check of their pacemaker, and that requires the use of specialist equipment that we bring with us. We check their heart rhythm, we check their battery, we check the condition of the leads, we adjust the programming of the pacemaker and check whether they've got any other rhythm problems that are recorded by the pacemaker that might need medication. And that service in itself also saves lives, because we can predict when the pacemaker needs to be replaced and we can plan for that to happen. If the battery stops, these patients will die as well. So the function of the pacemaker clinic is really essential in extending patients' lives. And we hold those clinics at Lautoka Hospital as well as at CWM.